Welcome back, and I'd just like to make an announcement that we are running over time today because we've had that many important interviews that we had to cover. The next one is equally important, and it is with Sesona Buyeye, Communications Assistant at Ibis Reproductive Health. And we are going to be looking at the Flow Forward annual lecture to drive change in menstrual health advocacy. A very good morning to you, Sesona. Welcome to the program. And of course, it is time to have a sensitive but important discussion.
Hi, Julie. Thank you so much for having me.
So tell us, what is this lecture all about? I see it says it's an annual lecture. Who is it targeted at, and what sort of a difference does it make? And I'm thinking very especially in maybe rural areas. I know it targets young girls during this phase of their lives. Um, how big is that impact, and how does your organization and ordinary people like myself, what can we do to make a difference?
Yeah. So the event is actually the very first of its own, the very first lecture, and it's going to be an annual lecture. It's hosted by Curate in partnership with the Menstrual Project. Ibis Reproductive Health, Salumi Health, as well as Viva Con Agua are some of the sponsors of the event. It is happening at Old Mutual Wanuka Place Auditorium. It's happening tonight, and it's just to commemorate the 10 years of menstrual health, menstrual hygiene day. So it just came about to just, you know, bringing forward menstrual health advocates, as well as young people that are impacted by the issues of menstrual health, to bring them together and just to kind of reflect on where are we now, where are we now from the beginning of this kind of campaign, right? Where are we now 10 years later? We're still facing where 7 million girls in South Africa are still unable to afford, their menstrual products. They're still unable to afford it. And as a result, and this is an African issue as well, not just for South Africa, but it's an African issue where young girls and menstruators rather are unable to afford menstrual products, and as a result they miss school. So it's
Mm,
important to reflect on the impact of the work that we've done through Menstrual Hygiene Day and through menstrual health advocacy, to reflect on how far has our advocacy gone, and where can we go beyond that, how far can we go beyond that. And so today there'll be three events happening in, or three kind of many events happening in the lecture. So we will have Ibis Reproductive Health is hosting an Amaze viewing party at the beginning of the event, where we will be showcasing some of Amaze Africa's menstrual health videos and sharing those resources to the people that will be attending the conference. And then there'll be two panel discussions happening afterwards, just discussing menstrual health advocacy, menstrual health work. And these are by the various partners that have come together to collaborate on this event.
So, with this collaboration, does that indicate that there will be menstrual health products available, hopefully freely, to those 7,000 girls that you've mentioned? Because if they don't get these products and the education around menstrual health, they are missing valuable days at school, are they not? Having said that, I'm also aware of several NPOs that are working in this space, raising funds and making these products available to young girls at schools, needy young girls at schools.
Yes. So, for example, Ibis Reproductive Health, we are part of a coalition for menstrual health management in partnership with Curate as well. And we have actually begun rolling out one of many, hopefully, events where we go into peri-urban communities and speaking to the learners in those peri-urban schools, and giving them information for menstrual health, giving them empowerment, but not just giving them information, but even helping them get these products freely, right? And so part of this coalition is to ensure that not just that they're getting the information that they need to ensure a healthy, dignified period, but to also ensure that they actually have resources for their periods. And so when we attended this event, we actually had to kind of take in some data to find out whether or not they are getting the free menstrual products that have been made available by the department. And so just to find out if they aren't, what are the reasons behind that, and ensuring that when we come back the next time, they are able to get these products. But when we arrived at those at these events, we don't just arrive empty-handed. We provide them with dignified packs or period dignity packs and keep it going.
Did I understand you correctly? Are you suggesting that perhaps that you referred to the department supplying these packs to the girls? Are you talking about the Department of Health?
So, yes, so the coalition that I am referring to is the South African Coalition for Menstrual Health Management. And this coalition, we're in partnership with multiple NGOs, as well as the Department of Women, Young People, and People with Disabilities, as well as the Department of Social Development. And so they actually are the ones who are spearheading these events and coordinating these events, and actually inviting us to bring the resources and information that they ask us to bring. And so when we arrived there, the representatives from these two departments were the ones ensuring that they are getting the menstrual packs that they need to be getting, and finding out if they aren't getting them, why aren't they getting them.
Who should be attending this conference?
So who should be attending this conference is everyone who is impacted by menstrual health, because we all know that, menstrual health rights are human rights. Not just women menstruate, there are various people who menstruate. We actually have a variety of people attending. We have young people attending, we have menstrual health advocates attending, we have NPO and NGOs attending, as well as corporations that are, passionate about ensuring that there is, awareness about menstrual health. So everyone should be attending. And if they aren't attending or aren't able to attend, there is a link on Curate's YouTube channel that they will be able to tune into the event virtually.
Sesona Buyeye, Communications Assistant at Ibis Reproductive Health. Thank you indeed for talking with us this morning. God bless and go well.
Thank you so much, Julie. Bye.
It's exactly 16 after 10, and before I leave you this morning, I would like to share Palestinian update with you. It's important, and please listen closely. Spain, Ireland, and Norway became latest European countries to recognize the Palestinian state. Israel's army continues to pound Rafah, the attacks coming one night after Israeli forces bombed a tent camp housing displaced Palestinians in a designated safe zone in Rafah, killing 45 people. Israeli military confirmed it carried out the attack on the camp, saying it targeted Hamas fighters. Kuwait Specialty Hospital, one of Rafah's two remaining hospitals, has shut down due to Israeli attacks. At least 36,000 Palestinians killed and 81,000 wounded in Israel's war on Gaza since October the 7th. The revised death toll in Israel from Hamas's attack on that date stands at 1,139, with dozens still held captive. We also understand that more Palestinians arrested in Bethlehem, father and son stabbed by settlers. The number of people arrested by the Israeli military in Bethlehem has risen to 8. Earlier, we reported that 3 people, 1 woman and 2 men, were arrested in the occupied West Bank city. Other recent incidents in the West Bank include Israeli settlers stabbed a father and son near the town of Beit Ainun, northeast of Hebron. Israeli forces demolished a house under construction south of the city of Jericho. And finally, Jewish Israelis have entered Al Aqsa Mosque in occupied East Jerusalem to perform prayers. That's the end of this bulletin. It is exactly 18 after 10 o'clock. Thank you for being with me on the show today. A shout out to our two producers. Technical producer is you, Abdusalam, and of course, our content producer, Nasreen Naidu. Thank you indeed. Thank you for watching and listening to us this morning. Go safe and don't forget, tomorrow is D-Day. Go out and make a meaningful difference in South Africa by casting your vote. Every vote counts. Assalamu alaikum and Khudafiz from me, Julie Ali.